In today's video, I wanted to spend some time talking with you all about what exactly an active ingredient is in your skincare products. I think this is an incredibly challenging area to navigate when you're choosing skincare products and you're trying to sort through all of the claims about what the product is going to do for you. So what is an active ingredient? Basically, an active ingredient is the ingredient in the product that is doing the work that the product claims it's going to do for you. So if it's a product that is claiming to treat acne, for example, the active ingredient is going to be the one that is doing the acne fighting. In the case of an acne treatment wash, for example, the active ingredient might be salicylic acid or it might be benzoyl peroxide. Those are active ingredients that treat acne. However, sometimes the product doesn't have any active ingredients, and that doesn't mean that the product won't work or won't do something for you. Say, for example, just an ordinary cleanser. Those don't tend to claim to have any active ingredients. They don't make any statements that the product is necessarily going to alter your appearance or treat anything, but they're merely functional, and I think we can all agree on that. Cleansers, they break up dirt, oil, sebum, and help to clean our skin. I guess you would say their active ingredients are a mixture of things like detergents and surfactants that help to remove that dirt, oil, and sebum. They also have thickeners and opacifiers, things that give them texture and generate lather. So there are a lot of different ingredients and cleansers that do the cleansing, but nothing's really called out as an active ingredient unless it is an acne treatment wash, for example. Then you'll have an active ingredient that's called out. But just your ordinary cleanser, your routine run-of-the-mill cleanser, it's not going to have an active ingredient called out. Same thing with moisturizers. Many moisturizers will claim to have an active ingredient, like CeraVe claims that all of its moisturizers have active ingredients that restore the skin barrier. They've got ceramides, right? That's their signature active ingredient. However, pretty much any moisturizer without ceramides can also restore the skin barrier. So it doesn't necessarily mean that the product having the presence of an active ingredient or the claim of an active ingredient doesn't necessarily mean that the product is going to work for you or do anything remarkable. And what active ingredients might work for some people are not going to work for all people. Here's another area that I think is important for you to understand that will kind of help you in sifting through some of the noise, I think. Skincare products that we buy, whether it be in the store or online, they're going to fall into one of two categories. They're either going to be an over-the-counter medication or they're going to be a cosmetic. An over-the-counter medication receives a lot more scrutiny and has a lot more responsibility as far as claims than a cosmetic does. An over-the-counter medication is something that will have an active ingredient that is intended to treat or prevent a disease or a condition. So, for example, some over-the-counter treatments include acne treatments, as I've alluded to earlier. Whether it be salicylic acid, that is an FDA-approved medication that can be sold over the counter for the treatment of acne. Benzoyl peroxide is another active acne ingredient that is approved for treatment of acne in over-the-counter products. Also, sunscreen. In the United States, at least, sunscreen is regulated as an over-the-counter medication intended to prevent a sunburn. And so active ingredients will be either zinc zinc plus titanium dioxide, or some different chemical filters that function to prevent a sunburn ultimately. So the FDA views over-the-counter medications as those that are intended to treat or prevent a certain disease or condition. And so the manufacturer has to be very specific with how it calls out those ingredients, and only certain ingredients are allowed. And I'm telling you guys this for two reasons. One, a helpful way to know if something is an over-the-counter medication is you just turn the bottle or the box or tub over and look at the ingredients. If it is an over-the-counter medication, the active ingredient is going to be called out at the top in isolation from the remainder of the ingredients. Sometimes, however, non-medications do this as well. Sometimes you'll see that. But in the case of a true over-the-counter medication, they're required to call out the active ingredient outside of the other ingredients. They have to call it out, and they have to say what the percentage strength of the active ingredient is, and then they have to tell you what that active ingredient does. So in the case of salicylic acid, if you flip over your acne wash and you see active ingredient, salicylic acid, 2%, and acne treatment, it's kind of what you'll be seeing there. And then below that, you'll have all of the inactive ingredients. So all of the stuff that makes the product have texture and lather, and all of those other things will be listed as the inactive ingredients. So that's kind of a way to know if it's an over-the-counter medication. But the other reason that's helpful is that if you see an ingredient that is being used in an over-the-counter medication, you can be confident that that ingredient has a lot of science behind its use, a lot of not only laboratory science, but also clinical data to support the use of that ingredient for the treatment of at least the condition or disease state that it claims to treat. So, for example, I keep saying salicylic acid, but we'll just keep that a running thread. Salicylic acid has a lot of data, both in the laboratory as well as in actual people with acne, a lot of data to support that it is an effective acne treatment. It is effective and it is safe. So you also get a little bit more confidence in the safety of the active ingredient if you know it is an over-the-counter medication. It's approved to be used as an over-the-counter medication. That means that doctors and scientists have been using it to show these outcomes for a long time, and so we know that they're safe and effective. However, it gets a little bit more gray because a lot of times cosmetics will include ingredients that are FDA approved to treat a disease or condition. Cosmetics will also use those ingredients. They just won't call them out or bring them to your attention. You'll see this all the time. So what is a cosmetic exactly, you may be wondering? The FDA defines cosmetics, I'll just read you the definition, as products for cleansing, beautifying, promoting attractiveness, or altering the appearance. A little bit more of a gray area. And a lot of cosmetics will use ingredients in the product that are also FDA approved for the treatment of certain diseases. But in contrast to the over-the-counter medications, the cosmetics cannot make any claims that their product is going to treat a disease or prevent a disease outcome. So for example, you'll find, again, salicylic acid, you'll find an over-the-counter acne medication face wash that has 2% salicylic acid. You'll see salicylic acid listed at the top, called out, acne treatment, you know what you're dealing with. But then you'll also go into the store and you'll find some anti-aging face wash that will claim to improve skin luminosity, improve skin radiance, have an anti-aging effect, just improve your appearance overall, kind of make claims like that. Flip it over, dig through the ingredient list, you'll see salicylic acid listed there. And so, a lot of times those ingredients, you can find them in an over-the-counter medication. And the reason I say that is because an over-the-counter acne face wash, 9 times out of 10, is a lot cheaper than an over-the-counter cosmetic anti-aging face wash would be. So that's kind of where it's helpful to know active ingredients. It's hard, though, to know all of the active ingredients that are approved for use as medications over the counter, but there are many. Some other examples, I mentioned sunscreen is approved for preventing a sunburn. So sunscreens have a lot of onus in terms of what they can claim and can't claim. Another set of active ingredients, though, is going to be those that are intended to protect the skin. Skin protectants. Dimethicone, for example, you will see called out actually in a lot of moisturizers as an active skin protectant, which is funny because the clean beauty movement loves to demonize silicones, but dimethicone, a silicone, is one of the most well-studied moisturizers, skin protectants out there, and it's fantastic. Likewise, petrolatum, and petroleum jelly and Vaseline, they'll call that out and they'll tell you the percentage of it, and it'll be listed as a skin protectant. Colloidal oatmeal is another one that you'll see called out mostly in moisturizing products. Moisturizing products that are marketed towards people with eczema, a true disease. These are things that are approved for use in dry skin conditions. So you see those active ingredients called out. When you see them, you can know that with confidence, hey, this has a lot of science and clinical data to support its use for treating dry skin. So that's another set. Another one though is dandruff, seborrheic dermatitis. Anti-dandruff shampoos are considered over-the-counter medications. So Head and Shoulders shampoo, active ingredient, zinc pyrithium, well-established ingredient for treating seborrhea. Also, selenium sulfide shampoos, Selsun Blue, that is another ingredient that has a good track record for treating dandruff and is FDA approved for over-the-counter dandruff treatments. So that's kind of how you can navigate ingredient lists as far as knowing like which ingredients actually have true science behind them. It's those. All that being said, a product that doesn't have any active ingredients called out or listed doesn't mean that it might not be helpful to you. Moisturizers, they don't, like I said, they don't usually have active ingredients called out. Cleansers, they do what they're supposed to do, what we need them to do. They take off our makeup and sunscreen and dirt and whatnot. They don't necessarily need to have active ingredients to be effective. Also, another key point is that just because something is expensive or just because something is a prescription treatment does not mean that it's necessarily more effective than inexpensive over-the-counter versions. This is true of many treatments in dermatology, actually. It's one of the reasons I love being a dermatologist so much, is that we have so many great over-the-counter affordable medications that patients can go into the store and buy themselves. They don't require a prescription or prior authorization from the insurance. Patient can go in and buy it themselves and manage their own skin condition. It's really empowering, gives them a lot of autonomy. But I think for patients, sometimes that's really frustrating to hear, especially if they've been waiting a long time to see their doctor or dermatologist, and they get there and they're like, oh yeah, you have this, and just go buy this shampoo in the store. And they're like, what? You're not going to give me a prescription? Like, what kind of doctor are you? But it's actually a great thing. And the over-the-counter stuff is just as effective, sometimes more effective than some of the more expensive prescription drugs that we can prescribe. So over-the-counter oftentimes can be just as effective, sometimes more effective than the expensive prescription things. Yeah, I love that about dermatology. I really wish though that we had even more active ingredients FDA approved for over-the-counter treatments, especially for rosacea. I would love it if we had over-the-counter azelaic acid in the percentages that have been shown to be helpful for treating rosacea. The percentages, I wish we had an over-the-counter cream treatment for rosacea that rosacea patients could buy. Likewise, the reason I would love that is because azelaic acid is also good for treating acne in pregnant women. It's safe to be used in pregnancy. So it'd be great if pregnant mothers had a evidence-based acne treatment that they just buy in the store versus having to deal with another prescription and prior authorization. Prescription azelaic acid in those percentage strengths in the United States runs about $300. It's pretty steep, especially with you may have other medications that you're paying for. I mean, that's a lot of money, and having a baby is not cheap, and then raising a child is not cheap. So it can be really hard for patients, and it can be cost prohibitive. I would love it if we had that over the counter. The last point though, whether it be a medication, an over-the-counter medication, or a cosmetic, is that percentage strength of the active ingredient doesn't necessarily correlate to efficacy, which I think can be a really confusing area for consumers when they're trying to buy stuff, and an area where you can get duped into paying more money for something that may not necessarily be better. In the case of benzoyl peroxide, that's a classic example. 2.5% benzoyl peroxide in over-the-counter acne medications is as effective at treating acne as 10% benzoyl peroxide. But 2.5% benzoyl peroxide, while it's as effective, it is much less irritating, fewer side effects than the higher percentage strength. So we always tell patients, get the lower percentage strength stuff. It works just as well. It's not as irritating. You have a better chance of sticking with it because your skin is not going to be as beet red and dried up and peeling. So that is a classic example, and I'm telling you guys that because we know that. That's something that we've shown clinically. We have clinical experience, a lot of clinical experience to back that up. But in the case of non-drug cosmetic ingredients like peptides, for example, we don't have that kind of data. So you're very vulnerable to cosmetic marketing in terms of they'll tell you, oh, ours has the right size and shape and amount and formulation. Ours is the only one that's going to work for you, and it's $300. Peptide serums, kind of fall in that category. Retinols are definitely one that fall into that category. There are so many super expensive retinol serums in the anti-aging market. That's like, dude, like back the bus up. Like we don't really even have the level of science behind retinols that we do the prescription vitamin A derivatives to really know the best formulation and percentage strength. And there's no onus on the manufacturer of cosmetics to use stuff that meets, kind of accepted standards. So it's really a gray area. But no, in the case of non-drug cosmetics, the concentrations and formulations of things haven't really been worked out like they have with the medications. We don't really have that level of data, so there are a lot of claims that they can make at that point. And because they're not drugs, they can really say whatever they want. The only thing they can't say is that their product is going to treat or prevent a disease or a condition. If a cosmetic does that, then the FDA cracks down and they get a terrible fine. So they shouldn't do that. And companies get in major trouble when they try and make claims that something treats something and it's not approved to say that. Sometimes though, percentage does matter. Say for example, hydrocortisone cream, you can buy it in the store at 1%, very low. And honestly, as a dermatologist, like I almost never use 1% hydrocortisone. It really doesn't do anything. Modestly treats a bug bite. But prescription steroid creams, there's a whole host of prescription steroid creams that we use in dermatology, different potencies, different formulations, different percentages, and one type of steroid cream at a certain percentage is not equal to another type of steroid cream at another percentage. I mean, it's a big area of the dermatopharmacopoeia is topical steroids. So that is an area where, your dermatologist, we have a lot of experience with dosing these topicals, and what you get over the counter is gonna pale in comparison to what we would prescribe for treating certain diseases and conditions. And the reason, the stuff over the counter is so weak and useless is that there are a lot of side effects that can develop with topical steroids. So we monitor for that really closely. We make sure the patient isn't developing those, and we wean them off appropriately onto safer topicals, hopefully other things they can buy in the store to maintain their skin disease. Or a lot of skin conditions and diseases just go away after a while, and so we don't really have to do anything long term. And so we just use the strong stuff for a short period of time. I would say overall you can have a bit more confidence in active ingredients that are FDA approved for the inclusion in over-the-counter medications to treat certain conditions. So there's a lot more science to support their use, not only in the lab, but in actual people. Stuff that happens in a dish, in a petri dish, or on a skin graft model does not always equate to what happens in real life. So these FDA approved active ingredients, we have real life data, and a lot of it, to support the use of that ingredient. But cosmetics, huge area of gray, not that level of data. So, say for example, a vitamin C serum. Vitamin C is a non-drug cosmetic that we have not, it has a lot of limitations. Stability, it can be very irritating, formulated in such a way that it actually gets into the skin and does some of the things it's been shown to do in small studies, like skin brightening, improving collagen production. We really haven't dialed all that down. We don't have the large body of clinical data to really get at the right dose, formulation, etc. So you're really vulnerable in the case of vitamin C serums to cosmetic marketing because, one brand's gonna be like, oh, we've got it down. We've got the right one. We've got the right one, and it's only $400, So you have to be really kind of practical about your approach to buying non-drug cosmetics in terms of what their claiming stuff does. That's really where you can get in a lot of trouble. And peptides are another classic example. Peptides, growth factors, cosmetic ingredients, they're expensive, and the right ones, the right mix, that's a huge gray area. So be careful, when you're buying stuff that you don't fall for the expensive marketing. On my channel, you will find several videos, numerous videos, going into detail about different cosmetic active ingredients that are non-drug cosmetics, like vitamin C, I have a video on. I have a video on arbutin, topical soy, tons of ingredients, peptides, growth factors. So if you're ever curious about, is a cosmetic product that has, this ingredient they're touting, is it worth it? Check out those videos. The goal in those videos is not to tell you guys what to buy. That's never my goal. It's to tell you what we know about those ingredients, so you as a consumer can be like, okay, based on what she's told me as far as what science we do know, I'm not sold on this ingredient that I need it. I don't know, can I stick to it even? I'm not gonna waste my money on it. Whereas other people might be like, okay, all right, that's enough for me. I still want to buy it. Or some people may be like, I'm interested in this ingredient, but based on what she said, I think I'm gonna go with the cheaper one, see if that works. A lot of you guys kind of navigate the market that way. And that's totally cool, I think that's great. And that's really kind of the goal of my videos, is not to tell you what to buy, but to help you kind of navigate claims. And especially since stuff is so expensive, and personally, I don't believe any of that stuff is worth it, but I do get that you all are interested in trying these things. So the goal of those videos is always to just give you some information about what we actually do know about the ingredients, so you don't, kind of get misled about what something's going to do for you. So I hope this video was helpful in terms of detailing what active ingredients are. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.